a tremendous fighter in the United States Senate, my partner, Ed Markey.
Thank you so much.
Senator Markey.
Thank you, Senator Warren, so much for your great leadership on this issue. To Governor Healy, thank you for your great leadership. Mayor Keefe, Dr. Curry, Jill Batty, Dennis Heapy, Senator Lydia Edwards, Amy Rosenthal, and Kate Walsh. Thank you all so much for all of the great work which you do. This is an historic battle, which we are right now in the middle of. This is going to be the defining battle over the Trump administration's Make America Sick Again agenda. And whether or not Donald Trump and Robert F. Kennedy Jr. are going to be successful in implementing this gutting of essential health care programs for our nation. Lyndon Johnson, when he signed Medicare and Medicaid into law back in 1965, he basically was going to attempt to ensure that the poor in our country got the same level of health care as the rich. Now it's 60 years later, and Speaker Johnson and Donald Trump and his MAGA acolytes are all marching towards the biggest cuts in the history of Medicaid and Medicare. Republicans want to slash $762 billion from Medicaid. They want to cut $500 billion from Medicare. They want to make it harder for people to be able to get their health insurance. By gutting Medicaid, Republicans are looking to loot a program that has guaranteed health care to 72 million Americans, including 2 million here in the state of Massachusetts. They're looking to steal from a program that pays for 70% of people who are in nursing homes are on Medicaid. 50% of all children in our nation are on Medicaid. That's the program that the Republicans are seeking to loot. The program that keeps grandma and grandpa in nursing homes, the program that takes care of 50% of the children in our nation, all in order to have a tax break for the wealthiest people in our nation. Providers are going to lose their jobs. It'll be harder for families to find a pediatrician, harder for people to get mental health care, harder for seniors to get help as they age. Families will lose access to care. And as millions more Americans lose their health insurance, skip appointments, ration medications, the billionaires who can afford concierge medicine will get yet another handout from the government. The rich will get richer in our nation, and the sick will get sicker. That's what this bill is all about. Instead of fighting for guaranteed health care for all, Republicans have left us defending the scraps. And this isn't a big, beautiful bill, as Donald Trump would call it. It is a big billionaire bonus and a bludgeoning of the health care system in our nation. But the fight to save Medicaid and Medicare is far from over. Now the package comes over to the Senate. Senator Josh Hawley is right. It's wrong to cut Medicaid, and it will also be political suicide for the Republicans in Congress. And we're going to make that case to them every single day on the floor of the Senate. Senator Warren and I are committed to that battle. Today, we will use all of our efforts to stop these cuts. We cannot agonize. We're going to organize. We're going to use this opportunity to put every Republican on record on every one of these cuts. We're going to make sure every Republican is seen by every American who wants to ensure that billionaires get tax breaks at the expense of ordinary people on the streets. We're going to slow down and stop this big billionaire sellout once and for all. And what we saw when they made the biggest effort after Newt Gingrich was elected in the 1990s is they passed, the Republicans in House and Senate, a huge cut to Medicare. Well, Medicare pays the bills for hospitals, along with Medicaid. The Revere Hospital went under. The Malden Hospital went under. The Stoneham Hospital went under. It's Medicaid and Medicare that pay the bills for these hospitals that then provide the emergency rooms, the ICUs that everyone in the Commonwealth, everyone in the country can use. That's what's at stake. It's the very nature of community hospitals, of community health centers, of all of these facilities that are funded ultimately by Medicare and Medicaid, and we're going to make sure that these cuts do not happen. And with that, I turn to a great leader here in the state, a conscience up on the floor of the Massachusetts State Senate every single day, Senator Lydia Edwards.